Welcome to this educational program. This module discusses spermatoceles. This information is taken from a recent review of the medical literature and attempts to be as comprehensive as possible. However, it may not necessarily reflect the experience of your healthcare provider or the specifics of your situation. This program is strictly informational in nature, and no attempt is made to provide opinion or recommendation. Please feel free to view this presentation as many times as necessary. You may also use the player on your left to repeat slides or to skip through them in any order you wish. A spermatocele is a type of benign, meaning non-cancerous, growth above the testicle. Some physicians use the term spermatic cyst or epididymal cyst. They are simply sacs filled with fluid and sperm that arise from the epididymis, which is the first part of the sperm duct and lies next to the testicle. Because spermatoceles are usually painless, they are sometimes discovered by chance when a diagnostic test is performed for some other reason. As mentioned, spermatoceles grow out of the epididymis, a coiled tube at the top of each testicle. The epididymis is where sperm is collected after it is produced by the testicle. The end of the epididymis is called the vas deferens. When a male ejaculates, the vas deferens carries sperm to the urethra, where it exits from the body. This slide shows the male anatomy and path of sperm transport in more detail. In this illustration, you can see a spermatocele just above the testicle, arising from the epididymis. While most spermatoceles are found in this location at the upper part of the testicle, this is not necessarily always the case. Because they are cysts rather than tumors, spermatoceles are not solid. Instead, they contain fluid. This fluid is usually milky in color but may be clear and may contain sperm. Most spermatoceles are very small, less than a centimeter in diameter. In many cases, they remain small, in which case they rarely cause any symptoms. If this is the case, there is no need to treat the spermatocele. In fact, in many instances, it may never be diagnosed. If, however, a spermatocele increases in size, it may cause discomfort or pain. Some men describe the discomfort as a sensation of heaviness in the scrotum. In this case, you and your urologist can consider the treatment options. The precise reason why spermatoceles develop is not known, nor do researchers understand why some spermatoceles grow while others do not. There are three main theories. A spermatocele may start to form when one of the tubes that transports sperm from the testicles into the epididymis becomes blocked. This would account for the accumulation of dead sperm in a spermatocele. The second theory is trauma. One of the testicles or the epididymis is somehow damaged. The third theory is that inflammation is the cause. It is not known exactly how many men have a spermatocele. This is because they are so often undiagnosed. Some researchers estimate that up to 1 in 3 men may have an asymptomatic spermatocele, meaning that the cyst causes no symptoms. While the exact cause is unknown, research does show that the likelihood of developing a spermatocele increases with age. Most spermatoceles that are diagnosed are found in men between the ages of 40 and 60. No particular race appears to influence the risk of developing a spermatocele. Some research has shown that men whose mothers took estrogen during pregnancy may have a higher than normal risk of developing a spermatocele later in life. Most of the time, small spermatoceles cause no symptoms. If, however, a spermatocele grows larger than about 3 centimeters, or just over an inch, in diameter, it may cause pain or discomfort. Some men have described the discomfort as a feeling of heaviness in the scrotum. Spermatoceles are often discovered by men who perform TSE, or testicular self-examination. Other times, a physician will find a spermatocele during a routine physical exam. In some cases, a diagnostic test is performed for an unrelated reason and the spermatocele shows up. If you are experiencing pain in the area of your scrotum or other urinary symptoms, it is more likely that an infection or other conditions rather than a spermatocele is the cause. In this case, your physician will take a urine sample or do other tests to determine if infection is present. If your doctor suspects that you have a spermatocele, a routine test called Trans-Illumination will be performed in the doctor's office. A special light is used to determine whether the mass is solid or filled with fluid. If the light shines through the tissue, a tumor, which is a solid mass, can be ruled out. If Trans-Illumination reveals a fluid-filled cyst, an ultrasound may be sometimes performed to confirm the diagnosis. High-frequency sound waves, which the body reflects, are used to create an image, in this case, an image of a spermatocele. It is rare for a spermatocele to cause complications. If, for example, there is blockage in one of the tubes that transports sperm in the epididymis, it is likely that the other open tubes will still function. For this reason, a spermatocele is very unlikely to affect a man's fertility or ability to have children. Because spermatoceles do not lead to other conditions and rarely cause infertility, no treatment is necessary unless the patient experiences pain or is bothered by the size of the spermatocele. In these cases, there are three main options: medications to control the pain, surgery, or a procedure called aspiration and sclerotherapy. The next several slides describe these procedures. If a spermatocele causes pain or discomfort, pain medications like acetaminophen or Tylenol may be recommended. Alternative medications include painkillers that contain a strong anti-inflammatory ingredient, for example, ibuprofen, known as Advil or Motrin. If you and your urologist decide that the best option is to remove the spermatocele, a procedure called spermatocelectomy will be performed. This is a surgical procedure that can be done on an outpatient basis, meaning that the patient goes home on the day of surgery. Either a local anesthetic, where the skin and tissues are frozen or numbed with injection of medication, or a general anesthetic, where the patient goes to sleep, can be used. The procedure is relatively simple, usually taking no more than 30 minutes. As with all surgical procedures, there are possible risks. Like all scrotal surgery, there is a risk of bleeding into the scrotum, wound problems, and infection. There is also a chance that another cyst will develop later on, called a recurrence. Another risk is that the patient will become infertile, which means that he will no longer be able to father a child. This may occur if, during surgery, the epididymis is accidentally damaged. This would be very unusual, however, as long as the opposite side functions normally. Finally, a rare but important risk to understand is that during surgery there can be damage to the blood supply of the testicle, causing it to die and shrink in size. Prior to or on the day of surgery, routine blood and urine tests may be taken. In the operating room, the area of the scrotum where the incision is to be made will be shaved. Just prior to surgery, either a general, a spinal, or a local anesthetic will be administered. To remove the spermatocele, the surgeon will first make an incision or cut into the scrotum. In most cases, the testicle is removed from the scrotum for a short time. This enables the surgeon to see exactly where the spermatocele is attached to the epididymis. After it's removed, the testicle is replaced and the incision is closed. In this illustration, the testicle has been removed from the scrotum. You can see the top of the testicle where the spermatocele is attached to the epididymis. Once the spermatocele has been removed, the testicle will be replaced and the incision stitched up. Self-dissolving stitches are used. After surgery, patients are instructed to wear an athletic support filled with gauze for 48 hours. This protects the incision and provides pressure against it. The pressure promotes healing and decreases the risk of bleeding. In addition, ice packs may be applied to the area for 2 to 3 days to reduce swelling. If necessary, pain medication will be prescribed. Most surgeons recommend patients to wait a day or two before showering in order to keep the wound dry. Strenuous activity should be avoided for 2 weeks. Your surgeon will schedule a follow-up exam to check on the healing process. Surgery is clearly the best option to treat large and bothersome spermatoceles. There is a high success rate in terms of relieving the discomfort caused by the spermatocele and a low rate of reoccurrence. Another method to remove a spermatocele is called aspiration with sclerotherapy. It is rarely used because of the risk of infection and the high rate of recurrence. In this procedure, the patient is first given a local anesthetic or freezing to numb the skin and tissues. Then a needle is used to suction out as much fluid from the spermatocele as possible. Finally, an irritant solution is injected to promote the formation of scar tissue. The advantage of this procedure is mainly the avoidance of a formal operation and the shorter recovery time. Patients do not have to avoid strenuous activity after the procedure. However, the risk of infection and the spermatocele returning is high, which is why this procedure is rarely recommended. To summarize, spermatoceles are non-cancerous, fluid-filled cysts arising from the epididymis, which sits next to the testicle. Most spermatoceles are small, less than 1 centimeter in diameter, cause no symptoms, and require no treatment. If a spermatocele is large or does cause pain, it may be successfully surgically removed. These online resources may help you find further information about spermatoceles. These modern references were used to assist in the preparation of this module and are available for your review on the internet or through your local medical library should you wish to do more reading on this subject. We sincerely hope that this module has furthered your understanding of spermatoceles. We wish you the best for the future, and thank you once again for viewing this educational program.